Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening and welcome to the special focus. My name is Zahid Jadwat and we are together right up until 8 p.m. this Tuesday evening. Coming up on the show this evening, yes, indeed, we will be speaking to yet another great panel. This time we have Professor Shabir Mahdi, who is a professor of vaccinology at the University of the Witwatersrand, and he is also a member of the Ministerial Advisory Committee on Health. We also have Dr. Jabulani Nkayenana, who is an epidemiologist and a senior lecturer at the Division of Epidemiology and Biostatistics at the School of Public Health and Family Medicine at the University of Cape Town. Last but not least, we have Professor Tim Tucker, who is a clinical virologist and an adjunct associate professor at the University of Cape Town School of Public Health and Family Medicine. So I guess we have quite a bit of expertise this evening. And so basically what we are trying to find out is, with the lockdown now opening up quite rapidly, I should say, what really is the way forward? How do we deal with COVID-19 after the lockdown? Will it be eradicated or is it here to stay? And on that note, I'm also looking forward to hearing and airing your thoughts regarding all of this. WhatsApp comments can be sent to 061 766 0355. Of course, you can tweet and tag at Salah Media and at Zahid Jadwat. Another way you can be heard is also by commenting below. If you are watching on our Facebook live stream, on YouTube as well, you can do exactly that. So let's see what's been happening since we last spoke. Now, a major ruling rather, was that of the Gauteng division of the High Court. Now, the High Court has ruled that government's lockdown regulations are not legal, but they will nevertheless remain in place for at least the next 14 days. Government spokesperson Pumla Williams said on Tuesday evening that government had taken note of the judgment delivered by the Gauteng division of High Court today, declaring the alert level 4 and alert level 3 lockdown regulations unconstitutional and invalid. The regulations around the ban on tobacco have not been affected by the order as yet, since those are subject to separate court challenges. Now, the court has further directed Minister of Cooperative Governance and Traditional Affairs, Ms. Nkosazana Dlamini Zuma, in consultation with the relevant ministers, to review, amend, and republish the regulations with due consideration to the limitation each regulation has on the rights guaranteed in the Bill of Rights. And in a 170-page affidavit filed last month, the Democratic Alliance said that the party opposed the draconian, that's what they called it, draconian limitations on the rights of South Africans that came at great economic cost. However, this judgment is not related to the DA's court case, as it was brought by Reno David de Beer and the Liberty Fighters Network. They echoed the same concerns as the Democratic Alliance, which took government to court in two separate matters that challenged the validity of some aspects of the hard lockdown. So, of course, another major topic of discussion this evening is also the protests that have taken place in the United States over the last few days. The United States has been rocked by days of sometimes violent protests after Floyd, a person by the name of George Floyd, rather, who is an African American, died while a white police officer knelt on his neck, ignoring complaints that he could not breathe. Now, former President Barack Obama has slammed the use of violence against protesters in the United States while praising the peaceful demonstrations which have been taking place. Obama echoed other lawmakers' calls for policy change, saying, and I quote, eventually aspirations have to be translated into specific laws and institutional practices. And in a democracy, that only happens when we elect government officials who are responsive to our demands. And these protests, I must say, have continued despite a restricted curfew in several US states. In Minneapolis, a truck drove into a pack of protesters before being stopped, and the driver pulled out and beaten by locals. The chant, "No justice, no peace," remained the rallying cry throughout Sunday. Meanwhile, on a weekend where a historical launch for SpaceX and NASA was overshadowed by rioting, another milestone was reached outside of Earth. The SpaceX and NASA crew managed to dock with the International Space Station. This is the first such American capsule to do so in 9 years. The crew may now be spending several months aboard the ISS before returning home. The World Health Organization has stated that there is no evidence that the coronavirus is getting any less potent. The World Health Organization was countering a claim made by an Italian professor in Lombardy who claimed that the coronavirus clinically no longer exists. A WHO epidemiologist replied that in terms of transmittability, that has not changed, and in terms of severity, that has not changed either. In the Eastern Cape, it's said that more than 20,000 people are still waiting for their test results. Logistical problems have led to no test kits for coronavirus infections being delivered to Eastern Cape laboratories, where test results are lagging by up to 3 weeks. I'm beginning to wonder, how does this affect our statistics, our national statistics? And now we have quite a number of confirmed cases in South Africa. The death toll is also rising. Um, the death toll is also rising quite fast. So that's something we need to also be concerned about. In other news, the Independent Police Investigative Directorate has recalled two investigators from a special task team probing corruption allegations against top police officials, including former acting police commissioner Humutsa Pashlane. Now, the investigators have also been told rather to hand over their dockets to head office. Interesting fact worthy of mention before we take a break. On this day in 1964, the Palestinian Liberation Organization, known as the PLO, was formed. So let's take a quick ad break now. And when we get back, of course, we are looking forward to that major discussion, which is coming up with three experts in the medical field. Stay tuned for that.
Listen to With over 80 years of experience, IG Hussein Company Taj Mahal Spice and Rice. For over 80 years, Osman's Taj Mahal have been perfecting the art of the perfect blend of spices, pure, aromatic, and well-seasoned. Spices to tantalize your taste buds. From creative cuisines to gastronomical gourmet goodies. From exotic odors to traditional dishes, Osman's Taj Mahal have remained synonymous with quality spices and condiments. Taj Mahal rice, beans, and lentils. Try our range of chili bite mixes, rose and ilachi syrup, our quick and easy biryani pack, and our traditional range of spice blends. Osman's Taj Mahal. There is no substitute for quality.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening and welcome back. It is the special focus indeed. My name is Zahid Jadwat and you are tuned into Salam Media. If you are listening via the web live stream, that's at salammedia.com/listen-live. Welcome to the show. If you are listening and watching rather via our Facebook Live, also welcome to the show. It's indeed a pleasure to be hosting you. Now, with the coronavirus lockdown alert level now having been lowered to level 3 as of yesterday, concerns are being raised about South Africa's preparedness to end the lockdown. Now, the World Health Organization, WHO, would not advise South Africa to relax its lockdown measures just yet. According to Health Minister Zweli Mkhize, the World Health Organization's guidelines for relaxing lockdowns are dependent on a reduction in daily case numbers and deaths, and South Africa's are only growing. But with growing concerns of catastrophic economic fallout and hunger, the country has no choice but to quickly end the lockdown. So tonight we are speaking to a panel of experts to find out if the country is anywhere near prepared to ease and eventually end the lockdown. First of all, let's welcome our first guest for today on the show. We have Professor Shabir Maji, who is a professor of vaccinology at the University of the Witwatersrand, and he's also a member of the Ministerial Advisory Committee on Health. Professor Shabir, Assalamu alaikum rahmatullahi wa barakatuh, and welcome to the show.
Alaikum assalam. Thank you for having me.
Professor?
Hello? Yes, can you hear me?
Can you hear me? Yes, I can. Okay. We also have Professor Jabulani, who is actually Dr. Jabulani Nkayinana, who is an epidemiologist and senior lecturer at the Division of Epidemiology and Biostatistics at the School School of Public Health and Family Medicine at the University of Cape Town. Welcome to the show, Doctor.
Good evening, Zahid. Thank you. Thank you for having me.
Dr. Nkanyanana?
Yeah, can you hear me?
Yes, thank you for joining us. It's a pleasure to have you on the show this evening.
Thanks.
Let me now also welcome Professor Tim Tucker, who is a clinical virologist and an adjunct associate professor at the University of Cape Town School of Public Health and Family Medicine. Welcome to the show to you as well, Professor Tucker.
Thank you very much. Good evening.
All right, so thanks to all of you for joining us, to the listeners as well. Now, Professor Shabir Mahdi, first of all, on Friday night, Professor Salim Abdul Karim, he's one of those advisors who is advising government currently on the COVID-19 pandemic. He said that although there's no room for complacency, the curve has been flattened. And I think that's something, that's one of the objectives of the coronavirus lockdown, which has been implemented since the 26th of March. So in your opinion, has this lockdown been effective and has it served its purpose? Professor Mahdi?
Yeah, so I think we just need to understand the reasons for the lockdown. And as you mentioned, the WHO has got certain criteria in terms of when a country should consider easing the lockdown. But those criteria are not relevant in the South African context in terms of the reasons why we went into a lockdown and the stage of the epidemic that we went into a lockdown. The WHO recommendations are really geared towards countries that have gone into a lockdown at a time when there's a surge in the number of cases. South Africa went into a lockdown at a relatively much earlier stage. And the reason for our lockdown was really threefold. The first reason was to try to slow the rate of community transmission of the virus. The second reason was to sort of buy time to better equip our healthcare facilities in preparing themselves for what is going to be a surge of cases over the next few months. And the third reason was that it was meant to be used as an opportunity when we can, under very contained conditions, go out trying to identify infectious cases, isolate them, follow up their contacts. That would be much less compared to if there wasn't a lockdown. Now, have we flattened the curve? And the answer is that we have not flattened the curve. And what happened during the period of the lockdown is that there was ongoing community transmission. So there's something known as the effective reproductive rate, which means that for every one person that's infected, how many other people is that person going to infect? In the absence of the lockdown, the estimate would be that for every new person that's infected, they would infect 2 to 3 other people. Now, for you to be able to contain the spread of the virus, that effective reproductive rate needs to come under 1. During the period of the lockdown, it remained at about 1.5. So it came down slightly, but certainly not under 1, which basically tells us that there was ongoing community transmission, and perhaps even more so in the Western Cape than in an area such as Gauteng. So the difficulty of interpreting the data that's in the public domain is that there's huge variability in terms of the testing rate that occurred as well, even during the period of the lockdown. In the first 2 weeks of the lockdown, the daily number of tests that were being done was actually fewer than the daily number of tests that were being done before the lockdown. In the last week of the lockdown, the number of tests that were being done was tenfold greater than the first 2 weeks of the lockdown. In the first 2 weeks, there were 40 cases each day on average that were identified. In the last week of the lockdown, there were 400 cases that were identified. So all that was happening is that the more that we were testing, the more cases that we were reporting. And the number of cases that we were reporting was proportional to the number of tests that were being done. So we did slow the rate of transmission, but we certainly didn't contain the spread of the virus. We didn't contain community transmission, but it at least has brought us some time in terms of allowing our healthcare facilities to be better equipped. Now, the reality also is that healthcare facilities aren't built overnight. It takes 10, 15, 20 years to build up healthcare systems. So we've been able to, the government and hospitals have tried to do as much as is possible over a 5 to 6 week period in terms of better equipping the healthcare services. Whether it will be enough, only time will tell.
So, Dr. Nkayanada, that's where I want to bring you in into this discussion. So, what would a suitable exit strategy entail? Is it best to end is it best to ease the lockdown through the risk-adjusted strategy, or should it be scrapped at once? Is that a viable option as well?
No, as Prof. Mahdi just eloquently put it, if we are easing a lockdown, the advice is that you have to ease it in a risk assessment, based on a risk assessment strategy, or based on how the transmission is unfolding and the pandemic is unfolding. So the government have chose a right strategy, the risk adjusted strategy to ease the lockdown. So you cannot just do away with the lockdown, because then you undermine the whole gains that Prof. Mahdi have just mentioned, that there was a purpose for the lockdown.
So, considering that we would erase the gains which have been made by the lockdown that has been implemented, do you not believe that perhaps we are easing the lockdown way too fast? I mean, since we had implemented level 3 of the lockdown, it's only been about a month until we've now lowered to level 3. Are we going too fast, as has been the concern by some sections of society, or is this the correct pace to go about easing the lockdown?
Yeah. So there are some things that you need to consider. So as when the easing of the lockdown was announced, it said the country would move through the lockdown, but then they would categorize different places based on the level of transmission, and which I think is also a correct approach. All the metros, I think, with the exception of Bloemfontein, are classified as hotspots. But I think the government has the dilemma, because at the same time, these areas that have been identified as hotspot, where you have to again intensify the public health transmission prevention, are also, the active, business and economic hub. So it's about trying, striking the balance between opening the economy and containing the virus. So you can ease the lockdown as a country, but I think the strategy of then having a different region classified differently based on the transmission, I think it's a correct approach. But it's yet to be seen what were you going to do with the hotspots, and I'm sure Prof. Mahdi and Prof. Tom Tucker may contribute more about that approach.
Now, let me now bring in Professor Tom Tucker into this discussion. Okay, so schools were supposed to be reopened yesterday. Debate and discussion about this, whether to open schools or not to open schools. There's been concerns that perhaps sending children to schools will likely result in a surge of infections in South Africa in COVID-19 cases. What's your thoughts on this? Is it correct to open schools as soon as possible, or should the academic year just be scrapped altogether, considering that there have been concerns that there might be a surge in cases? And do you, in fact, believe that opening schools will contribute to a surge of cases of COVID-19?
Well, I think firstly, scrapping an academic year is just not a possible option in the real world. And the second perspective that must be brought into this discussion is that whatever we do now, there is going to be a surge of infections. So those are really important to bear in mind when answering this question. And in all of these complex matters, it's not as if there's one right and another set of wrong answers. These are complex discussions that we need to engage with. But children and young adults do not operate autonomously. They do not operate on their own. They operate within the broader family structures, the broader societal structures. And what we need to do is ensure that what we do in the case of children and young adults in the schooling sector is that we balance risk and we balance opportunities. Now, what is interesting about the schooling sector is that it also is being discussed with the opening of schools at the same time that the broader economy is getting a release to function more normally. And I think it's important that we see that the school sector operates in the same kind of continuum as the rest. And these children will have their parents in the workplace, they will have their families in the broader society able to do more. What is important in this regard is that we need to protect children. We need to ensure that children are supported, that they are given the right education about COVID, that they're given the right personal protective equipment, that schools are prepared for them, that we know that social and physical distancing is one of the most powerful ways to prevent infections, as well as the using of face masks. And we need to make sure that when schools open, that schools are prepared not only to prevent infections, but also to ensure that when there are infections that occur, that these are, and people become symptomatic, that people are referred for care appropriately. And then there's also those that are in contact with those that are infected, that need to be dealt with according to the national protocols. But schools are not just about the young children and young adults. It also is the continuum of age gap with teachers and support staff not being young. And I'll come to the reason why I'm saying this now. They will go all the way up to retirement age. And what we see within this COVID-19 is a striking age-related severity scale, with children under the age of 18 having a far less severe illness. They may get the virus as regularly as older people, but the incidence of mortality is vanishingly rare, and the rate of severe disease is low. And so, in fact, it's not really the illness that the children and young adults will have. It really is their position within the broader society, the risk to teachers, the risk that a child or young adult will go into the schooling environment, become infected, maybe be completely without symptoms, and then take that virus back to their homes where they live with their parents, their grandparents, and they might have the more severe disease. But in answer to your question, my view is that it is time to reopen the schools and the post-schooling education and training sector, because they are part of the continuum. They are part of the environment which needs to be managed. We need to protect our children. We need to protect our staff members in schools. And I believe because we cannot afford to lose a whole year of the academic calendar, and because these environments can be managed and must be managed into the future, we should open it. It's important that we understand this virus is here to stay for the coming years. There's no drug that works against this virus, and there's no vaccine, in my opinion, for the next 3 to 5 years in terms of broad distribution across the world. We have to learn to live with this virus, and the schooling sector is part of that.
Okay, I just want Professor Shabir Mahdi to pick up on this discussion as well about opening schools, whether to open or not open. Now, Professor Mahdi, you have been one who has stated that schools should reopen because, according to you, life should continue as best as we can allow it to continue. Now, considering that, just as Professor Timtaka has mentioned, it depends on the children's position within society, how they can spread the disease without even knowing it, and we could then have more cases of COVID-19 and a quicker spread of the disease. Considering that, do you still believe it is a viable option to reopen schools as soon as possible?
Yeah, so I think I just want to reiterate something that Prof. Tucker said, and that COVID-19 is not going to go away at the end of 2020. We're going to have continuous outbreaks for at least till the end of 2021, if not into 2022. So whatever strategy we adopt now is not a strategy that's just going to be with us for the next few months. Because if you say we should allow this school year to be lost, then we'll allow 2021 to be lost as well, and possibly 2022 as well, which is obviously not practical. So what do we know about children and their ability to transmit the virus? So before I get to that, just one other point that I need to make. is we need to understand a lockdown on its own does not get rid of the virus. Okay, irrespective of what level of lockdown you're at, you can be at level 5, you are not going to get rid of the virus unless it's coupled with a whole lot of other things. When what is especially important is to be able to identify infectious cases and to actually test those cases, put them into isolation, trace their contacts, and put them into quarantine. The number of cases that we've got in South Africa right now on a daily basis makes it almost impractical to continue in pursuing such a strategy. So a lockdown on its own doesn't mean it's a magic bullet and that you're not going to have any more cases moving forward. Now, in terms of the school and the whole issue as to what role children might play in terms of transmission of the virus, so unlike in seasonal influenza, where school-age children are known to be an important vector of transmission of the virus to older age groups. Surprisingly for COVID-19, for SARS coronavirus 2, the studies to date have actually shown that children rarely infect adults. The major drivers of transmission of this particular virus are actually adults, and especially adults of the same age group. And the reason why that is sort of obvious is because adults of the same age group are more likely to engage with other adults of the same age group, so they're more likely to infect those adults of the same age group. Adults infect children. Children rarely, up to now, have been infecting adults. And children are rarely the ones that actually introduce the virus into particular households. So from all of the evidence that's been gathered, firstly, when a child becomes infected, and like Prof. Tucker mentioned, children are equally likely to be infected with this virus as adults. But when a child becomes infected, they're either completely asymptomatic or develop a very mild illness. Together with that, it seems that the duration of shedding of the virus, how long they remain infectious, might actually be less than adults. And the reason for that is not completely known, but part of the reason might be the manner in which the immune system, the body's immune system, mounts a response to the virus, which is better able to contain the virus in the child. And that's what also protects the child from becoming severely ill. So when schools open, and they should open without any question, when schools open, the only thing that what needs to be put into place is that there needs to be the non-pharmaceutical interventions, which are actually implemented as far as is possible. It's not always possible to have children to be physically apart 1.5 meters. But that itself shouldn't prevent us from opening schools. We still need to look at other interventions that are within our grasp to be able to slow the rate of infection. Whether children are at home or whether the schools are open, children are still going to get infected. We should stop believing that because children are at home, they're not going to get infected. Like I said, the main people that are responsible for infecting children are adults. If adults are going out to work, if adults are going to the shops, if adults are going to the centers to pick up their social grants and they're getting infected, they're going to bring that infection back home, and they're the ones that are going to infect the children. But by adopting and adhering to these non-pharmaceutical interventions, keeping physical distancing as far as you can, hand hygiene, the use of non-surgical face masks, avoiding overcrowded situations, by adhering to those sort of interventions, you can slow the rate of infection. You're not going to prevent people from getting infected, right? And I think as a society, we need to understand that. Right now, when we report there's 30,000 cases of COVID-19 in South Africa, that doesn't even represent 10% of the true number of people that have been infected in this country. The true number of people that have been infected in this country is at least 10 to 15-fold greater than the number of cases that have been diagnosed. So we need to understand it. It's really important. So people are getting infected, and many people who get infected, in fact, don't even know they're infected. Between 50 to 80% of people that get infected with this virus amongst adults will be completely asymptomatic. They won't have a cough. They won't have a fever. They won't know they were infected, but they are infected and they can transmit the virus as well. So that's the reason why it's important for all of us to use this to adhere to these non-pharmaceutical interventions. And that is what is going to assist us in this country to slow the rate of spread of the virus, which will assist our healthcare facilities to be better equipped when it comes with dealing with the number of with the people that were required to be hospitalized for COVID-19.
So I want to pick up on your thoughts about the interventions which we have taken as a country, our strategy which we've taken, the lockdown strategy which we've adopted to combat COVID-19, or to slow the spread, which is what you say. Are you satisfied with these interventions? Are you satisfied with the way that our country, South Africa, is handling the coronavirus crisis? I know you've co-authored rather an article in the Daily Maverick in which you say, alongside the other authors, of course, the main point of the article is that we need to stop random testing. I think that testing on a wide scale has been one of those reasons why we've been able to catch these cases that have been confirmed. We have been able to confirm them and record them. Do you think that we are doing the right thing when we are, in terms of the interventions which we have taken? You might want to also pick up on the point which was I mentioned, which was in that article about random testing.
Yeah, so the first thing is government doing enough? I think the government has done what it can do in terms of trying to control the rate of spread of the virus. At the end of the day, it's really up to the populace of the country in terms of how successful we are going to be with regard to slowing the rate of spread, which will assist our healthcare facilities, as I've mentioned. Now, when it comes to the issue of testing, we need to be clear. We don't do testing just to count numbers. That's not the reason you do testing. When you do testing, there needs to be a specific objective behind the testing. So when someone comes to hospital, as an example, the reason we test that person, if we suspect COVID-19, is that it helps us to understand how to manage that individual. And it also helps the healthcare workers to understand what type of precautions they need to take, what type of personal protective equipment they need to use to avoid themselves from getting infected from that individual. So that's what happens in a healthcare facility when they come to hospital. But for that to be effective, you need to get the test result back within 12 to 24 hours, because the longer the person is not diagnosed as being COVID positive, the less able we to determine what's the best management for that individual, and the more risk healthcare workers are at for in terms of being exposed. Now, in a community, the only reason you should be testing in a community is to identify infectious cases, put them into isolation, trace down all of their contacts, put them into quarantine. Now, the average person each day usually has about 20 close contacts. So if a person comes on day 2, as an example, after becoming symptomatic, you need to trace all of the contacts of that individual from 3 days before they became symptomatic up to the time when they go into isolation. So imagine a person gets a result within 24 hours, which is not happening currently. Currently, it's taking anything between 5 to 14 days for someone to get a result. Now, if a person gets a result within 24 hours, that person will effectively have an average of about 120 close contacts that needs to be traced for that one particular individual. When we diagnose 1,000 cases in South Africa each day, that's 12,000 contacts that need to be followed up. 1,000 times 120, 12,000 contacts that need 120. Well, you need to do the maths behind this. But there's a huge number of contacts that need to be followed up, right? And we don't have the capacity to do that. Now, what compounds the issue is that, like I mentioned, it's taking 5 to 14 days for those results to come back. So by the time a person gets this result back, after being screened in the community, it's on day 7 of their illness, by which time that person is much, much less infectious. And in fact, in many instances, they're no longer infectious. So it's a meaningless, futile exercise, simply because it's not going to help you to determine how to manage that person. It's not going to assist you to tell in terms of deciding whether that person should go into isolation, because that person probably doesn't need isolation any longer. They're no longer infectious. And to be able to trace all of the contacts of that individual now, that hasn't occurred over a 6-day period, but that now you need to follow up over a 10 to 12-day period of contacts, the total number of contacts that you need to follow up, again, becomes impractical within the confines of the resources we've got. And lastly, the reality is that there's a global shortage of these testing kits. South Africa risks running out of these kits very soon if we continue testing indiscriminately as we're currently doing, especially when there isn't any sort of a return with doing the testing that we're doing. So if we're not careful, we're going to end up in a few weeks with very little tests to even test people that are coming to our hospitals, to our facilities, who urgently require that test to understand how to manage them and for healthcare workers to be able to protect themselves. So we need to do a prioritization. The prioritization should have been done yesterday and not tomorrow, because we're facing a huge crisis, a major crisis, both in the public as well as the private sector, when it comes to our ability to test in the manner that we want to go about doing testing.
So I think we should take an ad break now before we continue. There's still much more which we would like to discuss, and I'm hoping we can fit in as much into this discussion, because I also want to speak about our healthcare systems are crippled. That's undoubtedly that's the situation, and it's unfortunate. Rather, I see Professor Ginjo Sami is also watching here. He's watching on the YouTube live, as well as many other people. If you want to get in touch with us and let us know your comments, you can WhatsApp us on 061 766 0355. Tweet and tag at Zahid Jadwat and at Salah Media. Alternatively, you can drop your comments in the comment section below if you are watching on YouTube or Facebook. Let's take an ad break, and when we get back, we will continue with this discussion. Please stay tuned.
Never before has humanity faced a pandemic like the COVID-19 virus.
The World Health Organization has declared the coronavirus outbreak as a global pandemic.
Penny Appeal believes in prevention being the cure, and we remain firm in standing by our commitment to support and help those in need.
The border is closed, so I'm very, very affected. So
they are lacking in the supplies.
I hope government can find a solution.
Our response is to provide hardship grants to those experiencing a loss in income in the months to come, and hygiene kits for the vulnerable at home here in South Africa and Syria and Palestine. Show compassion in the midst of crisis. Donate to our coronavirus emergency appeal now. Be proactive. Be aware. Help save a life. Donate today. Call 031 11 00 573 or donate via www.pennyappeal.org.za. Penny Appeal. Small change, big difference.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to the special focus. My name is Zahid Jadwat, and we have just about 20 minutes remaining until we have to end the show. It is the special focus. My name is Zahid Jadwat. Now, we are discussing COVID-19 and the way forward as the coronavirus lockdown is being eased. We are currently on level 3 of the lockdown. Now, before the ad break, we were discussing South Africa's interventions and how they've been working. Let me now bring in Professor Tim Tucker. Professor, an interesting question that comes up is, how does South Africa's interventions compare to the rest of the world? I understand we've had a head start in terms of reacting to this disease, because it had emerged in China way back then, as way back as December last year, probably even November. How do we stand in comparison to other countries in terms of?
Well, I think there are many differences, and perhaps I can just pick on 2 of them. In the first instance, I think that we see a tremendous variation across the globe in terms of the way that governments got in early and whether they were data-driven in their responses. And although, and you see everything from terrible decision-making and an anti-science approach by some governments across the world, to other governments taking a more sensible science-based approach to say, what are we dealing with and how best can we respond? And although we have such a terrible history with anti-science and HIV denialism in our past, in fact, when it came to managing COVID, although the government admits that it has made mistakes, in fact, it has attempted to be science-driven. It's attempted to be data-driven and trying to prevent illness, trying to prevent death, and trying to prepare. And so I think that even though one sees controversies in the media about whether the right decisions were made and whether a government was always listening to its advisors, in fact, it wasn't an anti-science approach. It was a pro-science approach in an attempt to try and respond. And I think South Africa has been lauded in many ways across the globe for having reacted early and reacted with regard to the data as much as was possible. The second thing I'd like to point out to is the way in which the government decided to try and prevent infections. And what we see across the globe is very different models of trying to prevent and doing physical distancing. And one has models that were more constrictive and impaired more on people's social freedom, such as I think that the approach that we saw in China was a very, very significant approach, monitoring social movement, to other countries where, in fact, lockdowns have been non-existent or very limited indeed. And I think what South Africa has done is it implemented early, and it implemented a process within which we had the national lockdown now for an extended period of time, within which there was physical distancing and there was a genuine attempt to slow down the epidemic. So I think just those two factors in terms of how I see South Africa responding, in that although it has been problematic at times, although there's been critique, there's been an attempt to be driven by the data. And secondly, although today's Constitutional Court ruling seems to question some of that, there's been an attempt to get people to stay in their environments, to work from home, not socialize, without impacting too much on the human rights and rights of association. But clearly, that point that I make now is up for discussion given today's ruling.
Mm-hmm. Okay, so Dr. Kayunada, I hope you are still with us. We are discussing the COVID-19 situation in South Africa and the way forward. As it stands, we still do not have a vaccine in the country, but there has been talk of a herbal treatment having been found in Madagascar. So, Dr. Kayunada, in your opinion, why is there no rush to get this tested? And if it proves useful, develop an official treatment?
Well, Zahid, it's the issue of the herbal remedy in Madagascar is one of those unscientific at the moment things that are purported. Prof. Taka just talked about how certain government have responded badly to this, and I think that's one of the examples of how the not to respond to COVID-19. You cannot just announce cures, and there's a scientific way of testing if the cure is or the whatever remedy works. So it's you can't just make those kind of announcements. And in South Africa, we have a history of the HIV epidemic where certain remedies were being purported. So it's a sort of history repeating itself. Fortunately, for us as South Africans, we have been through this. So just to say on this is like, it really divert to or miss opportunity for more effective measures to prevent the virus. The tested measures that exist are, as other profs have said, is hand hygiene, social distancing, wearing of masks. Those are the things that we have evidence that works. So of course, there is a process that's ongoing on finding the vaccines and other antiviral to treat this virus. Those are things that would take time to become available. So at the moment, I think the focus should be on emphasizing proven measures that work to prevent the spread of the virus, rather than sort of promoting untested cures.
Are coming from, but just to explain where exactly my question is coming from, I understand that we need to focus on the measures which we have in place at the moment. We need to put all our effort into using these measures, because those are the measures that we have at the moment and we can trust and rely on them. However, why aren't we rushing? The question is, why aren't we rushing to get this treatment tested and find out, does it work or does it not work at all?
Well, I'm not sure what you mean by we are not rushing. I think there is a scientific process of testing, like treatment and drugs. So, and I think WHO have sort of responded to Madagascar, or reach out to Madagascar to say this cure must also go through this process. I heard in the news, I think a couple of weeks ago, that even South Africa have invited to partner with Madagascar in testing this. So I wouldn't say there's no rush. I think there has been a response to say, well, if there are these claims, let's put them through a scientific process to prove that they are indeed a cure. So there is as far as I'm aware, I think it was the University of Pretoria that was working with the institute in Madagascar that have come up with this cure. So I cannot, in a way, agree with you that there is no rush. I think there is a rush. Also, science cannot be rushed. I think like I said, there is a methodology, a process to be followed, so that whatever is being promoted to be cure has gone through a rigorous testing and evaluation.
Okay, so Professor Shabir Mahdi, we have just about 9 minutes left, and I think it's about time we begin to wrap up this discussion. As it was mentioned earlier on in this discussion, in fact, you can't really set up a country's infrastructure overnight. And as you know, South Africa's healthcare system is probably in a pretty bad condition at the moment. We see our hospitals are under-resourced. We see all those kind of challenges which hospitals are facing on a daily basis. And I don't think the COVID-19 crisis would have helped that anyway. And I think the lockdown, as has been emphasized even, the lockdown has been put in place in order to allow us to prepare our healthcare systems. Now, how has prior mismanagement, that's my question, prior mismanagement of the healthcare system, how has that affected our country's response to COVID-19, and how will it eventually affect our recovery from the virus?
Yeah, so I think we need to be just careful. South Africa is not unique in terms of not being adequately equipped for this pandemic. You've seen what has happened in Italy. You've seen what has happened in Spain. There's many countries that simply were not adequately equipped. Now, yes, South Africa's healthcare system is fragile, but we're much better off than many other African countries. Even in the public sector, we think we've got problems and we should go and visit neighboring countries in other parts of sub-Saharan Africa to truly understand exactly how much better off we are. But at the same time, that's not an excuse for us not having made adequate investment in terms of healthcare facilities. So this is not the time to sort of lament about how poor our healthcare facilities are. This is the time to see what we can do over a relatively short period of time to make sure that our healthcare facilities are as equipped as they can be in terms of dealing with what is going to be the surge of cases over the next 2 to 3 months. This is the time to make sure that we've got adequate personal protective equipment for our healthcare workers to protect them from getting sick. And all of this is also really dependent at the end of the day, as I've mentioned repeatedly, on the populace of the country. A government can't build 20 hospitals overnight and stock it, and we don't have staff to actually even operate the facilities that are being opened up outside of the traditional hospitals. We literally don't have staff. So the only thing that's going to assist us as a country, and I repeat it over and over again, is for the populace, for South Africans to understand what it is that they're dealing with. And that is not to become scared of this virus, The virus is with us and there's no running away from it, and it's not going to disappear. But that is to assist government, to assist the healthcare facilities in terms of slowing the rate of spread of the virus. And that is to really, and the only way we can do that, as I've mentioned, is to adhere to the non-pharmaceutical interventions.
Okay, now one of the causes for concern also is hospitals are now starting to see cases of malnutrition as the economic impact of the lockdown begins to take its toll. Is it correct to suggest that we are now causing another catastrophe as a result of actions taken to prevent COVID-19?
Yeah, so this has been a major concern of the level 5, and that's the reason why we say you can't even remain at level 5, because it might be saving a few lives from COVID-19, but it might actually be causing more harm from non-COVID diseases. So during the 5-week period of the lockdown, as an example, there was a 50% reduction in the number of people that came forward to be tested for tuberculosis compared to the 6-week period before the lockdown. There was about a 33% reduction in the number of people that were diagnosed with TB in that 5-week period compared to the 6-week period before. Now, the lockdown didn't get rid of tuberculosis. All that happened is that people's diagnosis has been delayed, which means that they remain infectious for a longer period of time, and their treatment initiation is delayed, which means their outcome is going to be poorer. So that is just one example. What we also know empirically about the lockdown is that children, as an example, who aren't at risk of developing severe disease from SARS coronavirus 2 were less likely to be immunized, which means children are going to become more susceptible to dying and becoming ill from other causes of pneumonia, from other germs that cause a diarrheal disease, as an example, whilst not really being at risk for COVID-19. So children are less likely to be immunized. We talk of the livelihoods of people being affected, and that is what is happening at a family level. And when a parent can't put food on the table, you don't expect children not to become malnourished, right? And these are things that are going to evolve over a period of time. It doesn't happen overnight. It takes maybe 1 or 2 months for it to occur, right? So those are the realities that we need to face up to. So at the start, we mentioned, is it too early to stop the lockdown, to phase out the lockdown? The answer is we don't have options, actually, right? The lockdown served a particular purpose. We're at a different stage of the epidemic. We don't have an option but to go to a lesser sort of level of restriction so that people can actually earn a living to be able to put food on the table, to be able to feed the families. Our children need to be able to go back to schools so that they get an education. And by going back to schools in many settings, in many areas of the country, that's the time when the child only gets, it's probably the single most nutritious meal for a day as part of the school's food feeding schemes. So we reached a point where we need to accept that the virus is with us. The question now is how best to actually adapt our behavior so that we can contain or at least slow the rate of spread of the virus.
Mm-hmm. Okay, we have just 3 minutes left until we end the show for today. Professor Timtucker, I just want you to wrap up on this point of the virus. How long can we expect it to survive? How long can we expect it to be around us? I believe we would have to integrate COVID-19 into our daily lives. And as Professor Shabir Madhi just said, we will have to adapt and try our best to lower the rate of transmission as best possible. So how long do you expect this pandemic to last?
Zahid, I think that, as Shabir Madhi said, this virus is here and it's here to stay. It's not going away in a short time. It's going to remain with us. And what we see is its infectiousness means that it is moving through our communities at a relatively rapid rate, perhaps not as rapid as some viruses like measles and such like, but it's moving through our communities. And so we would expect, some of the models expect, that 50 or 60% of society is going to be affected in the coming year or two. And in the absence of a treatment, in the absence of a vaccine, we need to learn to live with this virus. So treatment may come along sometime soon. We hope so, but at the moment there's nothing that is available. And vaccines take time to develop. And even if we have a vaccine that has been developed in a laboratory, it then needs to be tested in animals, and then it needs to be tested in a series of clinical trials in humans. And if at that stage it does show that it works, We then need to ensure that there are the manufacturing plants for making that vaccine, the distribution networks around the world, and then billions of doses made to ensure that the whole world, not just the wealthy world, get those vaccines. And I'm laboring this point because it takes time. And I think that at a minimum, my view is that we're going to have this virus around for 3 to 5 or more years. And even if we vaccinate, it may not be eradicatable in the same way that we've managed to eradicate smallpox with vaccine, but almost no other disease has been eradicated. We've managed to reduce it. Vaccines are the mainstay of trying to reduce the impact of this virus and other viruses. But it's going to take some time, and we need to learn to live with this virus, normalize our societies, normalize our economy, normalize our schooling and other environments so that we can learn to live with this because it's not going away.
Okay, and there's much more which we would like to speak about, but unfortunately time is against us. There's other things to talk about, like as well as how do we live with this virus as long as there's no vaccine. And I see a comment which has just come in from Surya Azad. She says, Western Cape should not go to school as the risk is too high. Plus, it's winter. Schools should open in September. There are too many people that have chronic conditions. Dr. Jabulani and Kayunana, I think you might want to wrap up on that point there. What do you make of the risk of the surge of infections which has come upon now that we are easing the lockdown?
Well, I mean, I want to just emphasize what Prof. Mahdi and Chaka have said. As we are easing the lockdown, the preventive measures, or what Prof. Mahdi called non-pharmaceutical measures, become more important. And I think when what Prof. Chaka talking about normalizing, I think we should, as a society, normalize these measures. Hand hygiene, social distancing, wearing of masks should then become a part of the norm if we're going to live with this virus and prevent the outbreaks and the surge of cases.
Unfortunately, that's where we're going to have to leave it for today. Thank you so much to all of you for your time. Professor Shabir Mahdi, who is a professor of vaccinology at the University of the Witwatersrand and a member of the Ministerial Advisory Committee on Health. We also had Dr. Jabulani Kayunina, who is an epidemiologist and senior lecturer at the Division of Epidemiology and Biostatistics at the School of Public Health and Family Medicine at the University of Cape Town. We also had Professor Tim Tucker, who is a clinical virologist and an adjunct associate professor at the University of Cape Town School of Public Health and Family Medicine. Thank you all so much for your time, and thank you to the listeners as well for joining us this evening. It was indeed a great pleasure to be hosting you on this important discussion that we've just had about COVID-19 and how do we exactly move forward. I think it's all up to us to take our precautionary measures, wear our face masks, practice good hand hygiene and overall good hygiene as well. So from me and the team, it's a goodbye for this evening. Just a quick comment which we will squeeze in here. Anwar Peer comments here, what about people with chronic diseases and chronic conditions? I think that's one of the main questions which has been hovering around in this discussion. But nevertheless, it's time for us to leave it there. Thank you all for your time. Assalamu alaikum wa rahmatullahi wa barakatuh.